Hello and welcome to the My Dietitian Journey podcast. My name is Adam, your co-host and producer. With me, of course, Felicia Peraza of Peraza Nutrition and My Dietitian Journey.com. Maybe?
This summer.
Okay. Coming this summer. We're going to talk about some stuff with insurance, billing, claims, various doodads, things, bits and bobs. These are all questions that have been asked. So this is sort of an FAQ specific to insurance with coverage, billing, issues, Superbills, which are disappointing. If you consider the name, you'd think it's something cool. It's something.
Yes.
So we'll get into that. But first, insurance coverage. Should we just jump in? Do you want to preface this at all with anything specific?
No, I think you covered it. It's
Great.
Mostly questions I
Heck
get.
yeah, I did my job. How do you ensure insurance will cover services ahead of time?
So the first place that I honestly start before even making any phone calls is to check the medical policy for each insurance company. So if you go on the website, honestly, if you just Google the insurance company name and the nutrition counseling, that should help you to get to the correct spot. But otherwise, you'd go to the provider section of the website, look for the medical policy, and usually it's under nutrition or medical nutrition therapy or nutrition counseling. Every insurance company kind of has a little bit of different phrasing for that. But this has information about CPT codes, ICD-10, and the place of service codes that are accepted. So that's kind of the first place to just get some baseline information. Next, I would go to calling the insurance company, which I don't do as much anymore because I kind of have an understanding of most common plans that I get. But when you're first starting out, and this is what I did, is just to call the insurance company, get a feel for what happens when you call an insurance company to verify the benefits. You will need to have the client information on file. So you need to have their member information. You're going to need to have their date of birth, your NPI, and the CPT codes. And then make sure you always get a reference number for the call. But that's one way to verify services and coverage.
So it's medical nutrition therapy. It would list whether or not medical nutrition therapy is covered. It's 97802 and 97803 and 4 are like the main ones, right?
Yes.
So that's what you're looking to see if those CPT codes can be billed for with that company. Do they list the codes or just medical nutrition therapy as a title?
So usually it'll either say medical nutrition therapy or nutrition counseling, and then those CPT codes. So under the medical policy would be, there's usually a drop down for CPT. There's usually a drop down also for ICD-10 codes, which we are going to talk about again, because that is something that there's certain ones that you could bill for and certain ones that you need referrals for, or medical documentation, because as a dietitian, you cannot make a diagnosis for medical conditions. So there's certain codes that are listed there that you can't just use, that you have to make sure that you have documentation for.
So they're typically like BMI codes, like the Z, whatever, and then hypertension, stuff like that.
Yeah. So like the BMI codes, you can use those because it's just a mathematical equation. I use Z7 1.3 a lot, which is dietary counseling and surveillance, which is pretty broad. But there's also ones like hypertension, obesity, which is technically considered a medical condition, which is like an E code, diabetes. There's all sorts of ICD-10 codes, but those would all be listed as what's billable. And then also general information about nutrition counseling. So like usually there's a section, like with some insurances, like Independence, for example, says, 6 preventative visits covered. And then like a little star that says subject to members plan and policy. So that's where calling is beneficial, but at least to give you some baseline information as to the general CPT, the telehealth information, all of that kind of things would be what you want to look for on the website just to start off with.
Have you run into any surprises with coverage? Have you had to learn these things from experience? What kind of weird stuff has happened to you? Any examples?
Yeah, so I not really understanding plans. Like I just thought, like for example, Independence, like it's just Independence, but then there's also Medicare-based plans. There's all of these like the HMO, the POS, like all of those kinds of things, PPO, and just kind of not really understanding what all of that meant. And I didn't realize for certain ones, like with 6 visits, everybody gets 6 visits, but if it's a Medicare plan, depending on if the policy is their primary versus their supplemental, they might not actually get 6 visits and they might be subject to Medicare guidelines. And so some of that I just kind of learned the hard way because I didn't realize that not everybody actually got 6 visits under independence. And that's where calling was beneficial to understand the policy information for that specific member or for those specific plans under, a whole company.
So you had claims denied.
Yes.
Because it wasn't covered, even though you thought it was, because of some way the policy said this or that and you misinterpreted it, or you just were under an incorrect assumption. Had you have called to verify, you may have not run into that. This is usually a bigger problem for new clients. Once you have an existing client, their policy, nothing changes. It just kind of, I assume you should do some due diligence with confirming, but if there's no update to the policy and it's the same client, otherwise new clients, this is something you would be more careful with.
Exactly. That's once I'm working with a client, I don't call every single time to check for benefits. It's, kind of in the beginning, or I work with a lot of clients who have the same plan under a same company. And so with something like that, I don't call to verify benefits each time. I also now have a script that with prompts that I send to the client too. So even if it's a plan that I'm familiar with and I know that there's probably a certain amount of coverage, usually I'll send over like a PDF document with their initial paperwork that just walks them through calling their insurance company and what questions to ask. And it's the same things I would ask, like the CPT codes. And a lot of times when people call me now, they're like, I found you on my insurance directory and I called and my insurance told me that I get this many visits or that many visits or it's unlimited. And so those are the cases where the client's already made that step. And so I just document that with the client.
Just want to confirm that you're saying that you send with the initial paperwork after you schedule a client. One of the things that you do is you send them a script that they can use to then they call their insurance company and they go down the script of questions you've sent them. These are questions that you've specified for them to ask their insurance company on their own to call to verify their coverage for themselves.
Yes. Yep.
Cool. All right. Yeah, that's a lot of stuff. Coverage can be a problem. Good to verify. I'm surprised you trust them to actually do, because have you ever had a situation where, and it's not like people are stupid, it's just they don't understand the industry. They don't, people maybe don't, they're not familiar with their policy or their coverage. Have you ever had a problem where somebody called with your script and they somehow got to a point where they thought they were covered, but they actually weren't?
Yeah. And honestly, it's not really even the fault of the client. It's sometimes the person that they speak with who gives them incorrect information. Like I've had clients call and then I've called where the rep says, oh, they have a $20 copay. They have this much copay. And then I bill and there actually isn't a copay because it would say it exactly on the explanation of benefits that you get, the client responsibility, and if there's a copay. And so, it will be like a plan that I'm like, I know this plan doesn't have a copay for it. And then if you call again, you get a different rep and there's information like that. Or I've had actually with a Medicare-based plan that Medicare was primary, the insurance was secondary. I'm not really even sure how the rep didn't know that was the case, but they had said to the member that they get 6 visits, and really they didn't get 6 visits. They got 3 hours under Medicare guidelines, and they needed to have diabetes or renal disease for coverage. So I have had instances like that where that's where I kind of check the plan myself to see if it's a member. And then once I had a member that their policy actually was not by calendar year. It was like July was the end.
It's fiscal year. Usually that's called, which is weird.
Yeah, I just didn't realize that was the case. And I was billing 6 visits for the year of preventative coverage. And they said that they one of them was denied. And I was like, how is this denied? We had 3 appointments, but it was fiscal year. So things like that I didn't even think about asking because I never ran into that issue before. And so that's something that can happen, but
I don't know. We called that the fiscal year at my old job when it was July to July. I don't know. That's weird that an insurance company would do that.
Yeah.
So there are issues sometimes with coverage, even if you get them to call. If anything, this is another thing where it's like the more you do it, the more you get into it. You get used to these policies and you get used to how this stuff gets treated when people call or when you call. So it's something that gets easier with time. But when you are first starting, especially with new clients, this can be a problem.
Yeah, and it does get, a lot of people talk about, well, should I even accept insurance? And these kinds of issues, they can happen. And again, they can happen a lot in the beginning when you're kind of figuring things out. And learning the questions to ask and what things to check ahead of time. But it gets a lot easier. Like we don't have all of these issues all the time with lack of coverage or things like that. So it does get easier the more you do it.
Most of the time we file the claim and it's done. A lot of your clients now are not new clients. Most of your clients right now are just like returning clients, like where it's a follow-up. So this doesn't happen to us now, but it may happen in the beginning. It has happened to you.
Yes.
Not that big of a deal. So with billing, when do you submit an insurance claim?
So after the service is rendered is when you would submit. So what you're actually submitting the claim for. You need to have specific information, which you can only have after you've had the actual session as to how much time you've spent with the client, what kind of codes you need to use. You do generally have a year to file a claim. Now you want to check that with each insurance company, but most of them follow the 1 year mark. So you do have a little bit of time that if you're not sure how to bill or you need to get some things together or you're using a billing company, that you do generally have a year time frame to submit the claim.
Yeah, we have claims waiting to be issued right now, billed for. And we have some weird stuff going on with a couple of Medicare claims that their system changed and we were just unsure how to handle it. So, that was like a couple weeks. So it's not like you have to bill right away either. Usually it's like a day or two. Sometimes I bill like the same day or you've billed the same day. It can be a few days later, a week later, whatever. Just, don't feel like you have to. There's no weird little time frame to do it.
It's not really short. It's again a year. And that's, so if you happen to get a claim that's denied, which we're going to talk about, that's, you still have that time frame. So if you need to correct the claim or contact the insurance company, don't, worry that you have to get it done right away. You might want to before, if you have like, let's say a follow-up, in case there is an issue with coverage, but you do have generally a year time frame.
So where do you submit claims?
So we use a combination now of online tools that are either provided by the insurance company and then also my EMR, which I use Simple Practice. So in terms of just the general ones that I use from the insurance company, so Independence uses what's called Paraportal, and these are all free online tools, and these are also the ones that the insurance company recommends and wants you to use. I use Navinet for Highmark Blue Cross Blue Shield. We just started using PACE, or whatever. No, I keep calling it PACE.
PCACE. It's Medicare's new. It's new, but it looks like it's from the 90s for some reason, and it's their new thing, whatever.
Yeah.
It's awful.
Along with NovitaSphere, you use both the PCACE for creating the claim and the NovitaSphere for actually submitting the claim, which if you are new to using the system, they have a ton of free help guides on their website, and they are actually pretty nice when you call them and they usually answer. So we're still kind of figuring it out ourselves. But and then United Healthcare has their own billing platform on their website and their provider portal section. And then I use my EMR for certain insurances like with Cigna and Independence Administrators and anything else. I'm trying to set it up for Medicare now because it's going to be easier than the system that we're looking at.
So there's like 4 different independence flavors of independence, and you bill them in different places. So just saying independence, I guess, is not like so Independence Blue Cross. There's a bunch of different independence variants of insurance, and they get billed different places. The Paraportal and Navinet are really easy to use in my experience, and it's amazing how clunky PCACE is in terms of Medicare's system, and apparently it was much easier in the past.
It was so much easier when you billed right through NovitaSphere, because I used to do the billing for Medicare there, and it was so simple. But once you just navigated through the screens, you just entered in the information. I mean, it was pretty simple. You can do an overview. Now
it's some weird program that looks like it's out of Windows 95, and you generate a .dat file with that you have to bring over. It's really weird, but that's where you submit claims. Yes. Each insurance provider has their own or a different portal generally placed to. Is there any specific place where you submit claims for more than one insurance company?
I used to use Navinet actually for Independence and Highmark, and then Independence migrated to Paraportal. So there were a few that were integrated all in one. I guess my EMR is more of a centralized location of where I could do billing for multiple insurances.
I guess technically from your EMR, we could bill
everything.
Yeah, but it's
Yeah.
not easier, and there's a fee associated sometime, or there can be.
Yeah, so the price tier that I am in, I get 35 free included though with what I'm paying every month. 35 claims free per month, and then it's 25 cents up to 250 claims, and then that drops down for the next set. I do find that the online tools, because a lot of people will ask like, well, why not just use your EMR? It's all in one spot. One, it's just me in terms of like the provider rendering services. But I find that there's a lot of good tools integrated with the different systems, like with Highmark and like Navinet and Paraportal, that you can pull up the members' information. You could check that information. You could submit claim corrections through that website. So I find it to be a little bit easier to navigate other aspects of billing. The other thing too is that a lot of the insurance companies want you to update demographic information through those systems specifically. So regardless, you might actually still have to use them, even if you're not using them for billing. So I still have to update my practice location and verify the information every like 30, 60, or 90 days for each platform too. So regardless, I'm still having to go on those websites to verify information too.
In my opinion, Paraportal and Navinet, just in terms of user experience, are easier to submit to than your EMR, the one that we use. In my humble opinion, Paraportal, like visually, it's simple and easy to click through and look at everything. Yeah. So I think that's a benefit too. And
you can also, so I go also in there to download the EOBs, the explanation of benefits. You could check claim status and things like that. Using an EMR, you might also be able to check that kind of information, whether the claim was received. But I just find that there's a lot of, functions that you can utilize for those. And then obviously they're free. And if you're wondering, how do you know which platform to use for which insurance company too? If you actually go to the provider section for the insurance website, there's a claim section for those. And it'll say to submit claims, and it'll tell you where to submit. So if you go to Independence's website, it'll say claim submission, and there's a section on logging in and creating an account with Paraportal. So it tells you where they want you to send claims. So that's one way to tell.
So did we talk about why you don't just use your EMR for everything? I mean, did we really touch on that in terms of like the pricing and like investigating claims?
Yeah, I think we covered it.
Because you get so many included, and then after you exceed that number of claims in your EMR, you start having to pay a fee.
Yeah, which
isn't it really small?
It's 25 cents up to 250 claims, which isn't a lot. I just, again, the benefits of using those platforms for like claim correction, finding the EOBs, and then just having to update demographic information, I find is still worthwhile to be using those platforms. And, if I don't have to get hit with a 25-cent fee when using the platform is simple, then why not? But again, check your pricing and the type of EMR that you have, because some EMRs, you have to pay more. Like I have like the higher tier for my EMR just because of functionality, which we're going to talk about, but you might go with a lower tier where claims are going to be more expensive to submit, or there isn't a claim submission option. So you might have to be using these other platforms too. So,
do you like your EMR?
I do, actually. So I mentioned Simple Practice, and we will have in the
show notes, description, depending on whether you're listening or watching.
There's a referral link. So there's a $100 credit if you sign up that you get, and I get if you sign up for it. But I pay $199 per month, which they had just increased all of their pricing. And that includes telehealth, the 35 claims, like I mentioned, a biller and a scheduler role, which was important I needed that for Adam to be able to bill. Client portal, which is another thing that I was absolutely looking for with an EMR. Appointment reminders that are automated. So I can send reminders out 72 hours in advance through email and or text, and then 24 hours in advance. And then if it's a telehealth appointment, they get a 10-minute prior to the session reminder with the link again. Online scheduling, calendar sync, document storage, admin notes, so we could send notes to each other, mobile app, and then unlimited clients. So all of the things that I was looking for, it has, and I like the interface of it. They do have other tiers, like a starter option it doesn't have all of the functions that I mentioned, but for what we needed, I went with the higher tier because they just increased their pricing, and it definitely makes business a lot easier and streamlined having the EMR. So
Yeah, Simple Practice, not that I have experience with other EMRs, but it just as a person who's not an expert getting in and using it, it's pretty intuitive. There wasn't any figuring out. You click things and they go somewhere. Everything's labeled properly. It's a pretty slick looking UI. It's simple and it's very straightforward to find what you're looking for and to edit things and share things and whatnot. It works really well as just a piece of software, in my opinion. Have we had any issues?
The only issue I had, which I think this can happen with any platform, there was an issue with the telehealth being down, which now I have a backup for anyway.
I remember
that day. I was like, I have an appointment coming up in like an hour, and I ended up signing up for Doxy.me, which is free, and it's HIPAA compliant. So that's another option in terms of telehealth. You have to send the client the link. So that was one of the things that I had run into. Their customer support is pretty responsive and helpful, which is also very helpful if you're in it, because I had just submitted something for Medicare to try to utilize Simple Practice for my to be able to bill Medicare, and I filled something out, but the information was wrong, and so I contacted customer support, and they had gotten back to me within like 24 hours. I think it was only a couple hours later that they had submitted me some information. So that is something I find very useful, especially if you're running into like critical issues that you need addressed right away, is having a support team that is responsive and also helpful too.
So we had a situation where she had a client coming up and the telehealth server was down. They have their own telehealth server it's HIPAA compliant, that you would send a link to. It's part of what the automated reminders. It wasn't working abruptly. And you learn that in the moment.
Yes.
And then she sort of scrambled to find and got a backup situation set up. What was it called again?
Doxy.me.
And we'll link to that in the description, the show notes, just for reference. That's only happened one time in how many years of using Simple Practice?
Yeah, I think I've been using it for maybe 3 or 4 years. Might have been a little bit longer. And there was one instance where it said telehealth was down, but when I actually had when I looked on their notifications that there was a telehealth is down, but it was fine within like a minute. So there was no issue. This was like the longer time frame that there was a disruption for that. I went with Doxy.me. Now, just a note though, Doxy.me is just the video portion. So it's not like an EMR or anything like that. So I was still able to access my actual EMR Simple Practice, but I just used a different video functionality.
Yeah, Doxy.me. It's just a HIPAA compliant video conferencing app. That's all it is. And for reference, that going down is not crazy. I mean, YouTube has gone down in the past. Yeah. Comcast has gone, internet has gone down. Things happen. So, but take that for what you will. Are there other options for EMRs? What should someone look for?
Yeah, so there's a couple of smaller ones, or smaller for small practices, I should say. Practice Better is another big one that I see come across a lot. Healthy is another one, Calyx and Kaizen. And then there's also like larger EMRs like Epic and Allscripts. But what I would honestly suggest is shop around, do the free trials, and actually input a test client as yourself. So get a separate email address, like your personal one, and set it up as a test client so you can see what it looks like on the client side and also for you as the dietitian side of things. And you can get a feel for the interface, the functionality. There were, again, key things that I was really looking for with I wanted automated reminders. I wanted someone to be able to go on my website and schedule. I wanted all of those things, but I also wanted to be able to create my own templates, to have preloaded templates, to be able to upload documents and just kind of use it as a storage place, but also have a lot of flexibility in how I created documentation. And so I only knew that by actually getting in and being able to kind of mess around with the functions, and then also see it from the client view too.
No one's using Epic in a small practice, like a one person, are they?
No.
Yeah. So, I mean, you're not going to, or all scripts is another big one.
Yeah,
I mean, these
those-
are not, you're not going to use those. All right, hypothetically, if Simple Practice didn't exist, which one would you go for?
Probably Practice Better, I would say.
Any reason for that? Why?
The interface, I think I liked better.
Does it do all the same things?
Somewhat. I think the billing, and I'm not familiar as much with the billing now, but the billing was, and the Zoom, the capabilities for the video, I think were integrated through Zoom. So it's a HIPAA compliant version of Zoom, but there's still it's like a separate kind of function for that. And I think the billing is also separate. I think someone had mentioned that you have to use credits for the reminders for like appointments, unless you have like one of the top tiers. But I think that it was the most comparable to Simple Practice, and in terms of pricing too, I think that they were about the same. But all of the those companies, at least Practice Better and Simple Practice, actually have their pricing tiers listed like on the website, so you don't have to like contact someone to find out about pricing. And then you can also do free trials, which is nice, which I would highly suggest. Again, that was my mistake when I first was looking at EMRs. I just signed up for a free trial and like looked at them, and then I went back and did a couple of free trials again, but actually put in a test client, and that gave me a better understanding of like which one I wanted to actually go with.
So that's all stuff that's good to get into if you're just starting your practice and you're still waiting on a handful of things. Like, there's always a lead time with just getting started. These are good things to look into during that time frame to get yourself acclimated.
Yeah.
But
it could take some time to put in like all of the documents that you want to send to. So, and like setting up your templates for your email. So it's one of those things that you don't necessarily have to do right away, but it can be good to get it rolling before you have that first client that you need to start sending all this stuff to.
Yeah. So, if you're someone who's literally just starting and you're not sure what to do, this is one of the things that you could do. There's 100 things you can do in the time that you're waiting for certain things to happen, insurance companies to get back to you about, being a provider and whatnot. I guess that's one of the bigger bottlenecks, right? Yeah. There's just all this stuff that you could be doing if you wanted to. When you're billing for telehealth, how do you know what CPT, POS, place of service, and modifier to use?
So regardless, and this goes for everything relating to billing, is you always want to bill to match the actual service that you provided. So one of the things I consistently see and people ask about is like, how do I get paid for this? How do I bill this correct, like to get paid? And it's really about what the service you provided. You want to obviously get paid, but making sure that you're actually ethically billing too. So these also relate to the specific codes that are covered by insurance. So typically for CPT codes, I'm using 97802, 97803, and that's for medical nutrition therapy, the initial, and then the follow-up. So those are, and that's for an individual. Group sessions would be 97804. These are things that I know are on the insurance company in the medical policy that would be covered. And that's, again, what I would ask for ahead of time.
So 97802 is only the first appointment with a new client.
Yes.
Everything after that is 97803, even if it's like a year or two later or something.
Yes. Yeah. Then the place of service. Now, this is something that you want to check with the insurance company if you're doing telehealth and billing for telehealth, is how they want it coded, because when the pandemic first started, telehealth was being billed a little bit differently. And now most insurances have, a pretty solid outline of exactly what they want for telehealth services and what exactly will be covered. So the place of service is usually going to be 02 or 10, which is something that was added as a place of service code, and 02 was modified as of April 1st in terms of, it was modified actually January 1st, but put into effect April 1st, 2022. The 02 telehealth is when telehealth is provided in a place other than the patient's home. So they're at work, they're in their car.
Anywhere else but their home.
Yeah. And then 10 is they're in their home.
Which makes no sense. 2 should have been home. Usually if people do telehealth, they're home.
Yeah.
The telehealth place of service 02 was used for super long time, and then all of a sudden it's changed. I imagine a lot of people had problems when that first changed because they still kept billing for 02. It's not going to get kicked back because there's no evidence of it. This is this weird gray area where it's like, is this insurance fraud now?
Yes.
Because I billed for 02, but they were at work.
Yeah.
In all likelihood, and the IRS isn't going to come after you for this or anything like that. But just, this stuff is really important to get right just in case down the road. It's good to be aware of. I don't know why they set you up for failure and change 02 and add 10 when they should have just added they should be the opposite of what they are.
Yes, because I'm so used to putting O2 for everything that I have to go in and manually change all of these that I had O2 for, and so it's annoying. So that's for telehealth stuff.
What's place of service 11 and 12?
11 is for office, so if you have a physical office space, and then 12 is for a home visit. So I used to do home visits years ago, so I would go to the client's home, and so I would use place of service 12. So that's the place of service. The modifier is typically going to be 95 if you're billing for telehealth, which indicates synchronous telemedicine service rendered via real time. So you can't use email or anything like that. It's real time that you're sitting with a client, interactive video and audio. So depending on the insurance company, some of them don't require the use of a modifier. So the majority of the ones that I'm billing for right now require that modifier. And if you don't have the modifier, it will get denied. So
the point being, when you're coding your claim, you should try to be as specific as possible and bill according to what that insurance company wants to see. It's a shame that it's not just standardized across the board, but that's the reality of it. If you're a provider for 7 insurance companies, you're going to have to learn the tendencies of each individual insurance company. They're not too varied generally, but it's good to just keep in mind that there can be differences between insurance companies the way you bill for the same thing.
Yeah. And if you're billing again for telehealth and you're wondering what the policy is for a specific insurance company, the thing that I do every couple months, I'm signed up for provider newsletters now with different insurance companies for updates, but Google literally the insurance company name and then telehealth policy, and that should bring you to roughly the closest location of what you need, if not the exact thing of what the telehealth policy is and what specific codes and modifiers to use. So
this was an issue we had when we were trying to figure out how to bill Medicare with their fancy new system from the 90s. So are dietitians billing as a facility or non-facility? What's the difference?
So facilities are going to be hospitals, skilled nursing facilities like Medicare Part A type things. Non-facilities are basically everything else. So offices, home services, outpatient, private practice, and dietitians. So we are considered non-facility in private practice.
And if you're billing in a system and it's asking you a specific question about your facility, something's wrong.
Yes.
You're not a facility. You need to do something different. You're in the wrong place. Don't bill as a facility if you're a dietitian. Yes.
There are different pricings for those, and you're not considered a facility. So that would be one of those not ethical billing.
Yeah, weird gray areas where, that could be a problem down the road. But in this case, that would actually be something where the money changes.
Yes.
So be careful. How do you know if a client will need a referral?
So any kind of HMO plan or Medicare would require a referral. PPO plans are not going to generally need a referral. But again, keep in mind that if you are billing anything medical related, you cannot diagnose as a dietitian. So if you need some kind of medical diagnosis, which again, obesity falls under medical diagnosis, that's one of the ones I consistently see people asking about. You definitely need either physician documentation or just call and get a referral and make sure that you have that documented. You can't just go by what the patient says. The patient says, I have diabetes. You can't just say, oh, I'm going to pull a diabetes code and use that. You can't do that. You have to actually get documentation for the specific ICD-10 code and the specific diagnosis that you would need to use to bill.
So what kind of documentation do you get when a client needs a referral? You call the office. Do they just fax you something?
Yeah. So I have a template, and we'll put a link to a sample referral in the notes too. But I usually, when I call the office, I just say, I'm a dietitian. I'm working with a patient of yours and I'm calling because I need a referral on file. And they'll usually say, what's your name and whatnot. And then I'll say I need a specific ICD-10 code, nutrition counseling written on the referral. And then usually when you're asking for a referral, this is by default, it'll have the doctor's name and NPI, but usually I'll also specify that too. But most of the time I'll either get a fax with that information already pre-printed or like the literal referral pad scanned with nutrition counseling and then ICD-10 and obviously the patient's information too. So that's where I have a template that I'll sometimes send or give to a client to bring to their doctor's appointment. Otherwise, if you call, it's pretty standard. And if you get something that you don't have enough information for, just call them back and say, I need to have the physician's name on there, or I need to have the patient's name on there, or I need to have the ICD-10. But I just ask for that when I call. I'm getting a referral for nutrition counseling. Please indicate an ICD-10 on there. I need the physician's name, their NPI, and the patient's name and date of birth on there.
And then you are faxed or sent a document, and then you upload that to the EMR in the client, the client's profile.
Yes.
That way it's documented in your EMR for that client. And that's for if you need to produce it to justify the diagnosis. Do you send it to an insurance company at that point?
No. So if it's just to have on file, so you have the correct diagnosis, which I've also had physicians fax me like medical records instead. And so it'll have the diagnosis codes on there. And so that's fine too, because again, if it's not a specific referral that you need, you just need the medical diagnosis. Now, if you need a referral on file, like for Medicare, that is something that you need to actually indicate when you bill. So when you submit a claim, there's a section for the referring physician where you put their name, their full name, and then their NPI number. Same thing with like the HMO plans. There's a section that says like referring physician. So you'd have to actually put that in the submission for the claim, along with keeping obviously a copy on file. But if you're just obtaining it to have, the documentation for the medical coding, then you keep that on file, but you don't have to actually submit that to the insurance.
So then you have it on file. You bill for these diagnosis codes that you have a record of a physician diagnosing.
Yes.
And that way, this is one of those things where if you bill for it, but you don't have a referral, it's fraud. Mm-hmm. But it's not like the insurance company is watching you with whether or not you have it. If you don't have to submit it, how would they know? If you get audited, that's when it becomes a serious problem. Now you're committing fraud and you're liable to criminal prosecution, I guess.
Yes. And also you can have your license revoked too, and the academy and those kinds of issues as well with like your actual credential, because it could be seen as you creating a diagnosis for something. If you don't have any documentation for it, then you are acting out of scope of practice, which then can run into issues with ethics and, revoking those things.
Yeah, you don't want that. Make sure you get the referral if you need it, which you would for HMO plans, Medicare, and PPO don't require it.
PPO don't. But again, if you need it because you need a specific diagnosis, then just get a referral. It's a lot easier.
I guess the safe bet is to just get it whether or not you're not sure.
Yes.
What is the difference between medical and preventative benefits?
So we're going to link a lot of information on this, but most health plans cover a set of preventative services. And these are anything from like shots to screening tests, usually at no cost to the member. There's dietary counseling for adults that are at high risk for chronic disease. And these are under the U.S. Preventative Services Task Force. So there are two sections of that. So like obesity and then dietary counseling would be for high risk chronic disease that there's preventative benefits for. So these preventative benefits would be, again, anything that's outlined by the U.S. Preventative Services Task Force. There's a lot of preventative services listed on there that don't have anything to do with nutrition counseling, but the two that do would be for obesity screening and counseling, and then diet counseling for higher risk for chronic disease. So each insurance company has their own way of, allowing coverage for these preventative. And some of them have more coverage for preventative than others. But Highmark, for example, in their preventative policy, they have a section with adults who have a BMI of 25 to 39.9, which technically is considered overweight or obese. And this is where, there's a lot of debate on using BMI and as an indicator for health, which is not something that I agree with because it's literally just a mathematical equation with height and weight. So it doesn't really tell you anything else about a client's health, but it's important to know BMI because it's obviously used very much still in the medical field and for billing purposes. So with that, they allow for free preventative health visits, unlimited nutrition counseling for specifically obesity. So there's different language for each insurance company. Some cover 6, some cover 4, and some are actually unlimited for certain diagnoses or for BMI codes. So the important thing to note here is that these are generally going to be things that are at no cost to the member. It's more than just nutrition counseling. It's for other things like shots and screenings. But using the correct preventative billing guidelines is going to be really key to make sure that's billed preventative and under this preventative policy for each insurance company and not being billed as medical, which is where it would be subject to what's called cost sharing. So like a co-payment or deductible. So
cool. That's a bunch of stuff I don't know anything about. Glad you covered that one. All right, moving on to insurance issues. What do you do if you get a denial about a claim submitted?
So first thing is figure out why it was denied, which sometimes is very simple to say, but usually you don't get a ton of information as to the reason why something is denied. But you want to verify the reason. So did you use the correct CPT code? When I started billing first, I used 97802, and then I forgot to use 97803 the second time, and so it was denied. So I had to do a corrected claim. Did you use the correct ICD-10 code and code it to the highest specificity, which would be the 5-digit, I think is the highest, but whatever.
You're not really going to run into that. You're ICD-10 codes can be like 7 digits. There can be a letter at the end. You guys don't really have to deal with that.
Not really. Although I've had people had issues with this when they get a referral for like kidney disease and it's like N18.3 versus
XXA or something. You guys get those
with just 0.3 and nothing else after it versus 3.1. And so that's where there might be an issue with being more specific on the codes.
Some codes aren't billable.
Yes. And most of the time that's not an issue. Most physicians know what they're doing when they give you an ICD-10, but there could be an issue. So if there's an issue with the ICD-10, that's where you might need to go back to the physician and just ask them to indicate a different ICD-10 or, that this one is coming back as rejected by the insurance company. And they can usually give you an updated one. But
didn't we just run into something like that recently outside of the business?
Oh, yes, for me.
Yeah, because you're a doctor, the office tried to file a claim with your insurance company and the service wasn't. So there was something weird happened.
It was for physical therapy and they said that the code wasn't billable and that they needed a more specific code for like back lumbar spine. And I was like, they're like, what is it? And I'm like, I don't know what it is.
Yeah, let me consult my ICD-10 manual to find the code for you.
I'm not sure which one I'm supposed to put.
Well, either way, it's probably not going to be an issue for dietitians most of the time, but it can be.
Yeah, usually it's not. But in the event that that's something like that your ICD-10, that could be the issue. And you just reach back out to the physician's office. If you're unsure about the denial, this is where you would submit something like a claim investigation, which why we use Paraportal, because you can submit claim investigations and you could type in and ask why the claim was denied. So usually with whatever the billing platform is for the insurance company, they'll have a section where you can submit an investigation and get more information about the denial. If you don't have that option, or if you do that option and you don't get anything back, that's when you have to call the insurance company and go to the claims section of the prompts, and then you get to a rep and you can ask them about the denial. So
the last time we had a claim kicked back, it was because we didn't use modifier 95 when we were supposed to. And all you had to do was, once it gets kicked back, you submit a corrected claim, which is kind of a new claim but not really, because there's a little drop down menu and you just pick the option for a claim correction.
Yep, claim correction. And then there's, you usually have to indicate the claim ID. I'm probably using the wrong name for it, but it's on the actual claim that you submitted. You put the original claim number, that's what it is, on there too. Now, every insurance company has a slightly different process. Most of them are through their system now. So there's just an option for you to do a claim correction. For some billing platforms, you have to actually go into a separate location to do claim correction. But usually, again, you'll need that original claim number too.
It's not that big of a deal if you do get a claim kicked back and you need to correct it. It's really not like a big problem or anything. It's just you have to do a little extra work to get paid for that claim.
Yeah, it happens. So
insurance Superbills. What is a Superbill?
So it sounds really great, but
you think it was some big epic mega bill or like lots of bills in one bill.
So it could be actually. So it's a detailed itemized receipt that you basically give to a client with service information. So you provide this to a client if you are, let's say, out of network and you cannot or you do not submit claims to a client's insurance company. So if you are not in network as a provider for a specific plan, for a specific company, this is where the client would be paying you ahead of time, and then you'd be providing them with a super bill that they can submit to their insurance company for reimbursement.
What does the client do with the super bill?
So they're going to submit that, and them getting a super bill doesn't mean that they're actually going to get reimbursement. It's going to be dependent upon out-of-network benefits, and the super bill will not guarantee coverage. So that's something that I make explicitly clear to a client, is that I can provide them with the super bill, but it doesn't mean that it will be covered by their insurance company. And that's, again, they have to pay me first out of pocket before, and then they have the service actually too. But some people have asked about with super bills, what kinds of things can you give a super bill to a client for? I mean, you can obviously create an invoice and information about anything that you provide, but in terms of it being reimbursed, it would still need to be something that's a covered service under the insurance company, like medical nutrition therapy. But if it's something like a cooking demo or I don't know, a class or some sort, that it might not be a covered service regardless. So making sure that you're actually submitting something to the client that could potentially be reimbursed. Otherwise, there's kind of no sense in really having it. But
yeah, don't do this for something that's not a covered service, I guess is the...
Yeah.
Make sure it's a covered service. So what is... how does a client know if they can use their HSA or FSA for nutrition counseling?
So I've had clients ask about like health savings accounts or flexible spending accounts. Can I use that to pay for nutrition counseling? And with HSAs and FSAs, these are specific accounts. And the biggest thing that I would say is if someone is asking about this, one, check with the insurance company, because for insurances, they'll say on their website what would be eligible expenses. And then the IRS, which we're going to link also in the notes section, has detailed information as to what kinds of expenses are actually eligible. So there's a section on the IRS website that specifies for nutrition counseling, but there's also information, there's a lot of stuff on there, like medical foods and commercial foods, like certain stuff like that is not billable or class type stuff unless it's specific to a prevention of a chronic disease or things like that. So there's very, very clear information as to what actually you can use the FSA or the HSA for. So people just can't use it for whatever they want. They might be able to use it, but if they get audited by the IRS, there's going to be an issue, and
so
will be for you.
Were people asking about Superbills in terms of billing clients for services not usually covered? Like, what context were people asking about Superbills for?
Yeah, so for two things, I get a lot of questions about a Superbill for out-of-network stuff, which that's generally the biggest thing, is if you're out of network with an insurance company, but a client wants to work with you specifically, or they can't get in network with any provider in particular. There were a lot of questions that I have gotten from dietitians and then also seen on forums about providing a client with a super bill for something like a cooking class or for some kind of presentation that they would submit to their insurance company. But for things like that, again, if it's not a covered benefit, I mean, you could provide an invoice to a client and the itemized receipt, but it's not something that would be reimbursed by the insurance company.
Yeah, if it's not covered, it's not covered either way. If it's not a covered service, don't expect to get paid for it.
Yeah.
Or not, at least don't expect a client to be able to get reimbursement from their insurance company for it. I mean, if they pay you, that's one thing. And if you provide them the super bill, that's another. And that's probably wishful thinking if it's for a cooking class or something weird that's not specified as being a covered service.
Yeah. And keep in mind, if you are in network, you're not providing super bills. You are billing the insurance company. So this is specific to like out of network, that this would generally be the case, but not for you. If you're an in-network provider, you should be billing the insurance company directly and not billing the client.
So what information actually needs to be on a super bill?
So your information as the provider. So if you are already billing insurance in network, it's the information that you would essentially be billing for if you were billing for an in-network client. So you would need to put on there your business name, the rendering provider, which is who provides the service, which would be you, or if you're working with other dietitians, your credentials, your office address, your phone number, your EIN, your NPI, your license number if your state has licensure, the service information, which is why you can't provide this until after the service. So the date of service, the CPT codes, the ICD-10 codes, the number of units, the total charge, the patient information, so their name, date of birth, address, if there's a referring provider, so the provider name, the NPI, and that is everything. The Academy has a free template for members, Superbill. If it's for FSA or HSA documentation, make sure you review the IRS website for any specific information to be included, but all of what I just mentioned would generally need to be on there. So,
how do you keep track of we're going to cap it there with that's Superbills in a nutshell, folks. How do you keep track of your claims and financial data?
So for claims, I use a spreadsheet with the date of service, the date of submission, the location for claim filing, which I tend to use the same places now, but for claim filing, when I first started, it was like, where did I send things to and how do I do this again? The patient initials and then a column for whether or not payment's received. And then I highlight it once it's been paid out. For my financial data, I switched from using an online tool, QuickBooks, there's a bunch of other ones out there, to using just Google Sheets to track all of my expenses. So I track my personal expenses, my business ones, and then my income for both of those. And I personally like the spreadsheet because I can add notes. I can print the pages for my tax accountant. And then I also like that I can track other things on one spot, like the client appointments, and separate different sections with, the insurance company. And so I can kind of see where most of my income is coming from, whether it's a certain insurance company, in terms of co-payments or self-pay. I can track all of that information. So there's a lot of online tools. There's nothing wrong with QuickBooks. I just personally like the layout of using just an Excel document.
Probably something good to experiment to find your individual wants and needs for that sort of thing. But the main point is that you should absolutely be tracking it.
Yes.
Don't not track it. Yeah.
And my EMR too also has the tracking information for like claims submitted. And generally the thing is with using different platforms that if it's not all in one spot, I can go to Simple Practice and pull the claims that were submitted, but that's only the ones that are submitted through my EMR. So it's still having some kind of centralized document to know where I'm submitting different claims at. And I also found this to be really helpful because certain insurance plans that were billed under my local, this is a term that you will hear if you call an insurance company and they say bill to your local and you're like, who is my local? There are different payer IDs. And so just to give an example for this to make sense, something like the federal employee program is billed under Highmark. And if you look at a patient's card, it'll say Blue Cross Blue Shield, federal employee program. Like, where do I submit this claim? And so my local for that is Highmark. And so knowing that, I know that now.
How did you discover that?
There's a payer sheet. So there is a Excel document that Blue Cross Blue Shield has. And if you type in Independence Blue Cross payer sheet, we can actually link it too, because it's not like a protected document or anything. There is a sheet that tells you which payer to send your claim to, whether it's Highmark or Independence. So those are the ones that I usually run into where I'm like, which one is my local that I'm supposed to be submitting to? Where's, if they're out of network, where do I submit? And that was really helpful. And now I don't have to pull that sheet every time. I just know, oh, these claims go to that insurance.
So, and when you track your financial data, do you break that out weekly, monthly, quarterly?
Monthly. Yeah.
Okay, cool. Yeah, I guess that'll do it, right? Any closing thoughts?
Just that this probably sounds overwhelming of all the things to keep track of and everything with billing, and especially with the insurance. Again, that's a big thing that people ask about and say, with insurance, should I accept it? Should I not? It just seems like too much of a headache. And it is a lot to consider, but it is pretty, I would say, after you get to know the insurance companies, they are pretty standard as to what you need to do. And so it's just a matter of learning kind of the rules and regulations for each one. And so it does get a lot easier. And again, I find it very worthwhile to be an insurance provider and be a network. And it does get a lot easier.
Well, there's also a sort of altruistic mentality you can take toward this, because people have insurance plans. And if you're a provider, you are an access point for services for them now. This is how most people, at least in the United States, are insured. Mm-hmm. And this is how they get healthcare. So if you decide you're not going to take insurance, well, there's a lot of people that you just are not able to help with this. And what are you doing this for? Yeah. This is the question that comes to mind for me. If you're deciding you're not going to take health insurance, who does that hurt? Mm-hmm. It's an obstacle to learn how to do this stuff, but it's reasonable.
Yeah.
It's definitely overcomeable. It's not even a matter of whether or not you can. It's when will you. If you start learning this stuff, you'll eventually get it.
Yeah. And the one thing that I keep thinking about is we are not the only providers too. There are many medical providers. And, especially when we think about, and I hear about people talking about, pay cuts and changes to policies and all of that. We're not the only providers that are impacted by changes from the insurance company too. And to have a robust network is beneficial for a client to be able to see different providers and things like that. So just, in terms of the altruistic view too, this goes for a lot of other providers outside of dietitians.
So I guess that's going to do it for us here at the My Dietitian Journey podcast. Tune in next time where we talk about something different, but probably something with insurance, because that seems to be what people most ask about.
Yes.
This is sort of an FAQ. And I don't know, we'll figure some other interesting topics out at one point or another. But that's going to do it for us here at the My Dietitian Journey podcast. Thanks so much.